And she says, have you ever had surgery before? I said, no, this is my first. She's like, oh, honey, you picked the big one. Start with it. She's like, but we're going to take very good care of you. And she said, are you ready to go? And I'm like, sure.
What do you really know about people who are born transgender? Have you ever met someone who's transgender? Well, if you're like me, you're curious but hesitant to ask questions. Well, welcome to Demystifying the Transgender Journey. In our conversations with people who were born transgender, their families, friends, and the professionals who support them, we ask probing questions and discover insightful and educational answers. You can also find more information on our website, thetransgenderjourney.com. Now let's get right into today's episode.
Welcome back to Demystifying the Transgender Journey. We are so glad you're here. This is the space for real, honest conversations about the transgender experience and the people who walk alongside it, family, friends, co-workers, and healthcare professionals. Here we bring humanity to the headlines. I'm Wendy Cole, a gender diversity consultant, speaker, and proud example that it's never too late to become who you've always been, having transitioned at 67. I bring knowledge, education, training, and lived experience to organizations to help them navigate the ever-evolving social issues facing transgender and LGBTQ plus people. And today I'm joined by Lynn Murphy, the other half of your host team, an author, speaker, and leadership coach and founder of Women Who Push the Limits. She's the cisgender half of your host team. And together, we are here to open minds, touch hearts, and spark meaningful change. And today I have a quick heads up. In today's episode, we'll discuss the surgery, a topic not widely understood in cisgender world and could be informative to the transgender world. We approach this with care, respect, but we know these subjects can feel sensitive for some listeners. We assure you we'll keep it PG. Today, we're excited to welcome back Krystal after airing her two-part interview and after her recent surgery at Mount Sinai in Manhattan. Krystal is 42, has been married for 15 years, and is a proud parent of 2 adult children and is a Navy aircraft carrier veteran. She affirmed her gender 4.5 years ago after a lifetime of trying to meet expectations that never quite fit her. Now, like me, she's chosen visibility and is using her voice, story, and strength to help others better understand what this journey entails. In this episode, Krystal takes us through it all. We'll discuss the emotional, mental, and physical realities of surgery from preparation through recovery. Because surgery isn't just medical, it's deeply personal. It's about alignment. It's about finally living with a sense of congruence between mind and body that many cisgender people are unaware of and take for granted, despite the fact that they have it. Whether you're driving, walking, or taking a moment for yourself, wherever you are, settle in. This is a conversation that I'm sure you won't want to miss. Krystal, for your first question, take us back to that moment when you realized that you not just wanted, but needed surgery. And there is a difference between want and need. And then you began seeking consultations. Let's go back to that time frame.
So it was, I want to say 2 years ago. I was already well into HRT at that point, about 2 years. And while the bottom surgery was always something I thought about, it was something that I had, for various reasons, decided, well, I don't need it. It's not something that I felt was critical, at least at the time. But the more I worked through my dysphoria, the more I addressed things, the more I started actually acknowledging these issues and working through and starting to detangle that mess that was all that masking. I found that, yeah, I have a bigger problem with physical dysphoria than I initially thought I did. And it got to a point where it was causing, actual issues in my day to day. And my wife one day sat down with me and said, listen, this is a safety issue as well. She was concerned about, someday we end up in nursing homes. What happens if I am abused by a medical staff? We've got
Wow.
experience working in healthcare. So it's like the reality is that that does sometimes happen, even though it shouldn't. And she was concerned that, I look like a woman up top and everywhere else, but not being congruent was an issue. And my concern for traveling was an issue. So that was kind of the turning point. We're like, all right, let me start making some calls and figure out how to do this. And that was the point where I was like,
Yeah.
okay, let's find out what's required.
How did you go about finding surgeons to reach out to?
That was probably like the first really gray area to kind of wade through. You hear a lot about different places, but it's like a mixed bag. I mean, there's an offshore hospitals people go to. There's, all over the country, and you learn very quickly if you've had any surgeries at all that different surgeons have different reputations, and it's like trying to figure out which one is good for
Mhm.
you. I was very lucky. I know someone who had just had their surgery, and she mentioned what hospital it was, and another friend said, "Oh, by the way, there was a documentary on that particular doctor in that particular hospital on
Okay.
HBO." And I'm like, "Oh, neat." I like
Wow.
being able to see and visualize what I'm getting into. So I went and I found that documentary, and it answered a lot of questions. It let me see what the doctors looked like. It let me hear what their motivations were for doing what they were doing. And it did go into a little bit of what the process was to get it. And that really kind of solidified in my mind, okay, so let's narrow it down to this hospital system for me.
Mhm.
I live in New York. I got family
So,
near the city, so that was how we kind of decided on that particular.
okay. Was the documentary about Mount Sinai?
It was about Mount Sinai's program for providing gender affirming surgical care. Yes,
Wonderful.
I believe it was called Born to Be, and it should be on
Okay.
Amazon Prime. It's a few years
Oh,
old now, but
okay.
it was very interesting.
Born to Be on
Born
Amazon
to Be,
Prime.
I
Cool.
believe. Yeah.
Thank you.
We can
We'll
put that
put
in the
that
show notes. Yes.
exactly.
Perfect.
Like I said, it let me see what these surgeons are about.
Hmm.
It let me know what the process was. They follow patients through various different procedures, not just trans women, it's trans men.
Right.
So, I mean, it kind of showed me that, and I'm the kind of person I like to be able to visualize and see what I'm doing before I do it. My anxiety, and that kind of said, okay,
Uh-huh.
now I know the direction, and I can start researching each of the surgeons.
Before you started looking, what was the emotions you were feeling? What were your thoughts?
Oh God, fear. It was not knowing exactly where to even start, and just
Hmm.
what it means. Obviously, this is a big step,
Hmm.
and it just was something of like, am I ready for this? I mean, I've been agonizing over it for the bulk of my life.
Right.
One of my first memories was I don't feel right with my,
A lot of us do start off wanting the surgery, but
yeah,
one of the things that I was asked when I went for mine was, do you need it?
yeah,
That's a
exactly. I
key.
mean, getting there was mystery. Figuring out what doctors is a mystery. It's not like a lot of other medical procedures where there's a lot of established lines. You can very clearly figure out, oh, well, if I want to go to an optometrist, I just need to look up an optometrist.
Right.
This is something that's a little bit more murky. Some of the administrative lanes haven't been quite as well established yet. So
Right.
it was a lot of like, okay, this is going to be a really big thing. It's kind of a scary step. I didn't think I was going to need to. I was trying to avoid it. And now it's like, I can't. So it's like, now it's like, I
Right.
have to confront this. So it was a lot of emotions, a lot of, I need to start finding information to kind of combat that fear.
Okay. And so you got your consult. How did you feel going into that? What was that all about?
So to get the consult, I had to do a whole bunch of things, and it's something that it was the beginning of a very long journey. It was 1 year from my initial phone call with the office saying I'd like
Hmm.
to get a consult to the actual
Right.
consult itself. And in that time, I had to get, make sure all the paperwork was where it needed to be. I needed to make sure I had the letters written from the right people. There is a lot of steps in that process. It's not a, hey,
Hey, I
call
want
them.
surgery.
Exactly. It is, there was nothing straightforward about any of it. And
Right.
I love aspects of the healthcare field myself. And it's like, I knew it was confusing from the other side, but this is ridiculous.
How many
So,
letters did you
um,
have to do?
it depends. I can't remember if it was for the bottom surgery FFS, but it was at least 2 letters from mental health
Hmm.
and 1 letter from your PCP or your gender care
Right.
provider.
Right.
And that was, they had to be licensed. They had to, there were certain requirements, and you have to check with the hospital specifically saying, okay, well, what exactly do you need?
Hmm.
Not every hospital has the same requirement.
Exactly. They're all different
Yeah,
based on their administrative and insurance needs and all of that.
yeah.
Wow. So
It's a
you
bit of
can't
a
just snap your fingers and go get it.
no. No, there was nothing fast. There was nothing straightforward about it.
Hmm.
When I did finally get to go in for my consult, I was the last person taken in for the day. I was terrified. The staff inside the office was very, very nice. On the phone, the administration was a little bit prickly, but the medical staff was so, so friendly. And I went in and I finally met my surgeon, who I'd seen in the documentary for a brief moment.
Hmm.
And she was extremely friendly, extremely kind. She went over my medical history. There was no feelings of being judged or being looked at like, some doctors who just go in as a trans person. And even when they're supposed to be specializing in gender affirming care, you get the feeling that they're just kind of looking at you like a specimen. And surgeons, especially, I mean, they're not known for bedside manner.
No.
And was, she was absolutely amazing, very friendly. She explained everything in detail. She said, what are you looking to do? What are your expectations? Here's what I can
Hmm.
offer. And she did the physical exam, and that's where I found out what the requirements are going to be. And, this is a list of things that you got to do. This is your homework. You got to get these done. And one of those things, she wouldn't even schedule me until I met. And
Right.
those are things that nobody told me about before. So this is a lot of it.
Right.
Like, even though I knew 2 women personally who had gone through this, they didn't necessarily tell me all these things. So that was like, okay, I've now got homework. I've got some stuff I need to do.
Right. What were some of those things on the list?
So the biggest thing, it was 2 main things. The biggest one was BMI.
Hmm.
So at the time, I think, 34.7. I was like 230 some odd pounds.
Hmm.
Um,
I was
and
240 before mine.
yeah, they want you down at 30
Hmm.
BMI surgery. And she was very, very good. She explained why, because I'm always the kind of person, well, I want to know why. I want to understand and she said, well, it's going to affect your healing. If
Absolutely.
it makes it harder to do the surgery, more complications. It makes healing more difficult. Scars
Hmm.
are more if you've got too much weight on you. And there's also the anesthesia. There's so many things, and so they want you to have your weight down. They also want you to prove that you can be compliant
Right.
because you have to take care of yourself, and that's a big thing about transition that gets ignored is this needs to be a lifestyle change. You got to be eating right, exercising, taking care of yourself learning your body and paying attention when it says, hey, something's wrong. And
Mhm.
this is their way of saying, you need to be dedicated to your health and make sure that you're going to do your part before we are
Exactly.
willing to do this. And it's very invasive surgery for you, which I'm grateful now looking back. So there was
That was,
no official date though at that time.
mm-hmm.
Second thing was tucking. Oh my God, tucking. So I had never tucked. I wasn't sure how to do it. And when she said, oh, you need to tuck because what that does, and I'm going to get a little bit graphic, they, she takes, the member and she kind of pulls it down into the position that things are going to be once the surgery's done. And you want that skin to be, stretched a little bit. You want it to be used to being in that position because
Mm-hmm.
after surgery, when things start healing, you're going to start getting tension in that area and it can lead to pulling and tearing
Right.
and all these fun things that you want to avoid as much as possible. So
Because
she's like, you need to talk aggressively.
everything down
Like,
there is going to get rearranged and all of that. So that's in preparation to get the tissues and the skins that are going to stay in
yeah.
place used to being where they're supposed to be.
For the people who are uninformed about what the term tucking means, let's just please explain that. I know you don't want to get too
There you
graphic,
go.
but let's make sure that people are understanding what you're talking about there.
So tucking is something that a lot of trans women are going to be familiar with, and a lot of cross dressers and drag queens are going to be very familiar with. It's basically where you use various materials to bend and move your member so that it's kind of puts down underneath the body with the
Right.
contour of the body. And that way you can wear feminine clothes without the, boy parts making themselves a nuisance.
Without the bulge.
Exactly.
Exactly. And no one had told me this. I didn't know about it. I'd never heard of any of these before. I had reason to assume that there was going to be a weight requirement, but I didn't know this part. And
Right.
that's something I really want people to understand is, yeah, you have to tuck. I use tuck tape. Um, Tuck tape is basically like, in this case, it's from a company, I believe it's called Unclockable. And it's medical grade tape. It looks just like the same exact adhesive material they use on like band-aids, the fabric style band-aid. And it's shaped to go over
Hmm.
your bits with along with a sterile gauze pad. And I just use that. They're good for up to 8 hours. You can even swim with them. They're water for up to 3 hours, 4 hours. And I did that for the next year. Just aggressively wearing these things. And to be honest, once you learn to do it right, it's really comfortable too. So it wasn't too bad. So
It
those are
sounds
my
painful.
no, I mean, initially when you haven't figured out how to do it, it's a little bit awkward. It can be uncomfortable. But once you figure out how to do it, it's not too bad. And their website for Unclockable actually does have like directions, and they send you directions for how to do it.
Jesus.
I was grateful for them. Great, amazing products. But those two items were my homework.
Any limitations on medications yet or anything like that? No mention. Okay.
In my own research, I had seen that they're like towards the actual surgical date. Some surgeons do have requests like, we want you to stop taking estrogen up to 6 weeks before surgery
Hmm.
and progesterone and all those things. They said nothing to me at this point. So
And then how did you feel about meeting your surgeon and how did that change how you felt about yourself and the experience you were embarking on?
I selected my surgeon because they had a list and there was several in there. And originally I was going to go for the gentleman who started the program, and someone said, well, he's very, very busy, and normally they kind of shunt his overflow to this other surgeon. And they said, she's very, very good. She's also very popular, and I'm like, you know what? I feel more comfortable personally with a female surgeon. And there's just something about her bio on the hospital page that just felt right. So I went with her, and meeting her in person after having read her bio and seen her in a little blurb that she was in that documentary. She was absolutely amazing. She was friendly. She was more than happy to explain anything and answer questions. And that was huge because I've had experiences with my spouse getting surgery for issues she's had, and the surgeons are not always forthcoming with information or patient with you asking questions. And she and her assistant that was in the room with her were very, very friendly and gentle. It could have been a very awkward situation, and she made it as
Mhm.
comfortable as humanly possible. So it
That's
made me feel like
fantastic.
I made the right choice. So at
Yeah,
least I was hoping I made the right choice at that point.
fantastic. And so then you were really kind of psyched for having this happen.
Yeah, I was absolutely determined that I was not going to let anything get in between me and my goal surgery. So I put myself on a very strict diet and exercise regimen, and I was obsessive about it.
I
My
remember doing the
family,
same.
I drove my family up the wall. They really were just going crazy over, if I couldn't exercise the day, it just ruined my entire day, and I was sad. And I was avoiding any sweets at all. I mean, probably healthier than I've been since I got out of the Navy, to be honest, over
Mhm.
that period. But much to the surprise of the surgical team, I called them back by April,
Wow.
May, and I said, I'm below 33 BMI. I mean, that's when they said, call us when you get below 33 and we'll set a date.
Okay, now you saw them on what date?
It was like early February, like the 12th, February 12th of that
Okay,
year. So this is already a year waiting to get to that consult. And then they said,
okay,
okay, call us back when you're at 33. I called them back. I said, just hit 33 yesterday. And they said, okay, well, that's great. Call us again when you've been there for a week, a few days. We want you to consistently be there. I'm like, all right. So I'm pushing and working hard at it. And I called back by, you know, the end of May, and I said, I just hit 31 BMI. And so they're like, wow, well, all right. So let's set up a second consultation.
right,
The tentative date that we had was the 21st of February of 26. So that's a long time. A lot of things can happen. So they wanted to meet again just to make sure that everything was still good. And I had to renew some of my letters because those are only good for a year. And, so there's a lot more for me to do, but they said, okay, well, you're where you need to be. We'll see you in January. Like, okay, great.
okay.
Fantastic. I spent the next, part of the year just battling with my weight, trying to get my weight down. I didn't even have time to really think about, am I scared of this? Am I nervous? What is this going to mean? It was more
Okay.
my weight, getting my weight down and doing tucking, religiously and just, it was like I was given these instructions and I will follow them to the letter because that's what the doctor told me to do. That's where the
I'm not
autism is
surprised.
really happy. Exactly. So yeah, I got a call in November of last year, and they said that we've got an opening early if you'd like to come in for your consultation.
Right.
I'm like, oh great, when? And they're like December. Oh, okay, yeah, sure, that's amazing. Yes, absolutely. So I went in this time. I went in with my spouse. She came with me. She did not come with me in the previous appointment. And we get in there and they do the same thing as before, doing my paperwork and checking height, weight, all that stuff. And she was a little bit surprised when she put me on the scale. And she's like, you're 204 pounds. That's significant because I said I was 237 when I was there the previous February.
Right.
And she's like, she's like, you did a good job. She's like, we don't see people losing weight like that. That's doctor told me that's what I needed to do. She, did
Uh-huh.
what she was doing. She walked out, and I'm just sitting there thinking, did I do something wrong? And finally, the doctor walks in, the surgeon walks in, and she's like, well, there's my rock star. How are you? And I'm like, rock
Rocks.
star is not, that's not medical terminology. I'm not sure I'm not sure how to this. What does that mean? And she's like, so 204 pounds. That's absolutely amazing. And I'm just like, okay. She was almost giddy. She was so excited. She was almost bouncing in her seat, and she was just so excited about the whole thing because I'm assuming, judging by her reaction, that people don't always do that. They don't always like
Hmm.
follow that.
Right.
And so she started doing the same thing as before. I had to strip down. She had to take a look at things down there, and
Yeah. Yeah.
like,
You can't have any modesty in this
no,
process. There is no
no,
such thing.
yeah,
I,
your dignity's
I,
out the window. Um, but she looked. I forgot to mention before. They did say we need to do hair removal. So they gave me a pamphlet that actually had a diagram on it showing in electrolysis what needs to be removed visually
right.
and instructions for them. And I actually had a laser and electrolysis clinic near me that was recommended by someone else who had done it for them. And I was able to provide that to her clinically licensed operator, and she was able to do that. So that was another thing that I was doing through that whole year, once a month,
Right.
every 6 weeks, is I was going in for laser and then going into electrolysis the last 4 months, 3, 4 months.
That's one of the biggest challenges of this surgery in the preparation side is hair removal down below.
Yeah.
And it's not that comfortable.
No, and it was the first time I'd ever had laser. And I mean, to be honest, it wasn't as bad as I was afraid, but I know everybody's
Uh-huh.
different. Everybody has a very different
Right.
experience. And half the people I was talking to, oh, it's not bad at all. Other people like, oh my God, it was the worst thing, and I'm in tears the whole time through. And then when you get to electrolysis, it's like that's
Oh,
not
that's
even
all
worse.
lots of fun.
Like you don't know how you're gonna react to it until you're going through it. And I mean, for me, I was lucky. The technician that I had was super friendly. She was also an ally. She had done someone else, which is always important to make
Hmm.
sure you call into these hair removal places. Hey, will you do this? Because sometimes,
Right. That's the key because there's a lot of people who perform electrolysis that won't do the genital area.
yeah, it's always important to check ahead. Like I said, I knew she would because my friend had
Right.
gone through
Right.
her already, and that was about $100 per session.
Right.
So, I mean, and like I said, it was very nice because she used the high powered laser until there was no need for it, with all the dark hairs are gone. And then she switches over to the electrolysis.
Hmm.
So she's not wasting time and causing extra pain with the, electrolysis if she doesn't need to.
Right. You were
But
lucky you could do the laser because I was limited to just the electrolysis.
I wish I had done this sooner. I've said that about every aspect of transition, but I'll tell you what, hair removal is so much easier when you're younger.
Oh, yeah.
Did she use
So,
anything to numb your area?
my electrolysis, I don't know what you call the technicians, but she recommended Dr. Numb's cream.
Oh,
And I would basically time to the area where she's going to work 45 minutes to an hour before, and then I would cover it with saran wrap, keep it from rubbing off.
Right.
So if I'm doing my face, it's like I'd have my face be numb halfway, I'm driving out to her clinic. And then down below, saran wrap down there, pulling it in against my undergarments. So it was very, very awkward, but it worked.
Hmm.
this is a really
Right.
glamorous process, isn't it?
Yeah.
Uh,
And it's not something that you would readily choose to do.
No, no.
so anyone's had a laser, it's not the most comfortable thing in the world. And we're talking about a very sensitive area, to use the medical term, scrotum through the perineum. So that's got to be clear, and that's something that the surgeon was looking at,
Hmm.
and also very, very pleased. Now I only had laser up to that point. I hadn't had any electrolysis yet. And that's something a lot of people weren't sure of. Oh, you can't use laser. Well, this is laser over a year. And the hairs that were trying to regrow back were not growing back at that point. And then she had moved to electrolysis from that last appointment on. But she, did the stretch. She's like, and you've been talking. And I was scared because there was a period of time where I didn't so much because they're not cheap. They do get expensive, and we were kind of tight on money. So that was relief. And she's like, you are all set, and we'll get you in. Next time I see you, it'll be for surgery. And I'm like, that's fantastic. And my wife is there, and she's able to ask her questions. My wife is an LPN, and she's happy. Both of us have medical knowledge, so she's able to actually speak, medicalese with us and be understood. But my wife was there and able to ask questions, and she was showing and demonstrating to my wife what was going to happen, and my wife thought it was cool as heck.
Now, how did she
Like a
feel
mom, I
about
think
you embarking on this whole process?
my wife.
Yes.
I mean, I'm not gonna lie. That was the one thing she said when I first told her I was trans that she didn't want me to do. She's like, "You're not gonna get surgery, or you're not gonna cut anything off." And I said, "No." And at the time, I meant it. I really was honest. I was not. I didn't think I was gonna need it. Did I like the idea of getting it? Well, yeah, I kind of would like to not be feeling uncomfortable, but I didn't think I needed it. So I told my wife that way back when we first met, 2006.
Mm-hmm.
So that's a long time. And
Right.
when we got to this, somebody said, I'm going to transition. She's like, okay, but you're not getting the surgery. Or she used cut it off. And I'm like,
Mm-hmm.
no. And again, I meant it at the time. I really hoped and thought that
Of
the
course.
HRT was enough. But as
We,
you deal with issues, you find out how deep it really goes. And sometimes it's enough, and sometimes you need to do more. So that was unfortunate.
evolves from wanting it and thinking about it to getting to a point over time where you know you need to do this.
Mhm.
And that's what you
Exactly.
went through.
Was it something that did happen over time, or was there a place when you kind of woke up one day and said, "Oh, this is what's going to happen"?
I mean, it was always there, but it was something that I had lower priority on, or I thought I did,
Mm-hmm.
and I was willing to not do it, even though I wanted it to maintain my relationship with my wife.
Mm.
Mm-hmm.
I want to feel comfortable in my own body, but at the same time, I'm not entirely willing to give up my family. That's super important to me. But when she came to me that day, because I got to a point where I was avoiding the topic, I wouldn't even bring up bottom surgery. And that's my wife came to me one day and said, "You need to get this done." And that's when she mentioned she'd been thinking about it. She said, "What happens if you end up in a nursing home and you're incapacitated and the nursing staff, is abusive?" And this is coming from someone who's a nurse.
Right.
She is a nurse. She knows. I also did my rotation in a nursing home. While much of the staff is really very caring, there's always going to be people who are like, and that really scared her. She said, I think
Right.
for a safety thing that we need to do this. So that was a gradual thing that she had to figure out as well. And
Mm-hmm.
she really is the one that gave the final green light saying, okay, let's do this. The world is not safe, and we need to make it as safe as possible for you. So
Good.
it was a big thing for her. And like I said, she really was very much involved in everything from day one, and we're still going strong. So, but
Good.
yeah, that brings us up to December.
Mm-hmm.
And I'm now excited. I didn't mention it before, but to kind of help visualize it and celebrate, that I finally made the decision around March. I say, yeah, March of last year, I decided I would make a special way to count down to my surgery date.
Mm-hmm.
I took construction paper like you do in grade school, and I made a paper chain. When I was in like first grade, we made a chain that counted down to Christmas.
Okay.
Every day for Betty takes one off. I made one that counted down to February 21st of 2026. And so it was over 200 links long at the time.
Mm.
And
Oh, well.
I even went as far as the last 6 weeks were white because I had heard that a lot of surgeons want you going off of estrogen for the
Right.
last 6 weeks because of concerns about clotting
Mm-hmm.
and bleeding out while on the surgery table. So the last 6 weeks were white, and then the very last one, it was pink. And
Okay.
it was just around my living room. It was just, I had this drape was staying. It was so long. And then like,
Oh, wow.
looking at me, I'm just going to take off one every day. And it just kind of, it was something for me to focus on. It took me
Mm-hmm.
4 days to make this stupid thing. But that's the thing I like to do. You know, I have that childish kind of
I did
aspect.
some I did something similar with an app on my phone, and I've known other people who have done similar things, but I've never heard the chain. That's great.
Um, well, I get a phone call. I can't remember if it was in end of December or January. It might have been January. And it was a hospital, and they said,
That's this year?
yeah, this
Yeah.
year,
Okay.
26, we've got an opening. Would you be interested in moving up to date? And I said, well, yeah, okay. I mean, but how much are we talking about? I was like, January. And they said, that worth it. It was like, that's okay.
That's close.
I was like, absolutely. I was so excited, and I was like, absolutely. And I ended up having to let everybody know because I had to make plans for my job and plans for, you know, the insurance. Um, this is something that takes 5, 6 months to recover from.
Mm.
So I had to make sure that my job was aware that they were okay with it, how we got to pay our bills, that we had a place to stay. That's another requirement is that you have to stay within 90 minutes of the hospital
Right.
during the initial recovery, the first month,
Hmm.
so that you can go in for follow-up appointments and then you can check in if something goes wrong. You would rather
Hmm.
go to the Mount Sinai where they know what you're going through than to go
Right.
to like my local hospital where they're going to be like, what are we looking at here? I don't understand what's happening.
Hmm.
And it's just very awkward. So, I mean, we had to arrange all that. You can't go upstairs. You can't really care for yourself. You can't drive. So you have to have somebody to be there with you. And this is one of the things that is a major barrier to care for a lot of people is there's not a lot of places to stay in Manhattan or near Manhattan, you know, that are affordable and finding somebody to stay with you. I was very fortunate. I have family down there in the Bronx. I've got a lot of people in my immediate family that are medically trained, between my wife. I've got medical knowledge. Our friend who we're staying with was also in the medical field. So it's like we're covered. I mean, we had to move all of that up. I had to tell my boss, hey, listen, they just moved my surgery date up. And, you know, just heads up. So I had to get all my work done as much as possible before that date. And again, normally I'd be having anxiety over this. I've never had surgery before. And this is huge.
And this is your
But
first.
this was my first, but I was so overwhelmed by work issues because my job was getting very, very busy, very, very intense work being done. I didn't have time to really think about it. So I was literally working up until February 3rd was my last day working.
Wow.
And February 4th, I got up. I had intended to do a little work, but you know, we were going to have to go from where we live down to the Bronx, about 3 hour drive. And I also had to start doing the bowel prep. So anytime you have
Mm.
surgery down there for any reason, they want you to clean out your intestine because they don't want something in there when
Right.
you're, you know, having you're under anesthesia. So I started drinking this lovely 2 gallon jug of joy starting at noon on the day before surgery, so it's February 4th, with that delicious packet of lemon flavoring that they stick in the thing to make it palatable.
Oh, no, there's
Um,
no way it's palatable. I've had that.
so kind of to at least take a sip every 10 minutes. And it's like we were going to be driving. The way things were working out, we were going to be driving at noon. We were going to leave our house. And I would just recommend for anybody going through this, please refrigerate it. Refrigerate it. This stuff is vile when it's warm. And I'll tell you what, it worked because the whole way down, we had to stop at every rest area on the way down Interstate 87. And I'm a very big, I like food. I like making food. I like eating food. So it's like, I'm starving and this is just not fun. So we drove the 3 hours down there and I'm drinking this thing all the way in. I finished not long before we actually got there. And when we got in, we parked. It was me, my wife, and my youngest child. And we get in there. They had set up a room for me at the back of their house. It was straight in off the street, no steps, no nothing. The bed was set up, and it was like a perfect height, so they wouldn't have to worry about how to get in and out of bed. And I don't actually remember very much from when we got into the house to when I went to sleep. But I remember laying down. We had to be at the surgical suite at 5 a.m.
Mm-hmm.
So going from the Bronx to Manhattan takes about 40 minutes during the daytime when there's, with low traffic, as low as it ever gets down there. But we were up at 3 a.m. and I had almost no sleep. I was terrified of oversleeping. We got me Uber. I had all my stuff with me. You have to bring a donut with you, the donut cushion, and a bunch of other things. They give you a list. There is a list that they do provide saying, hey, these are things to bring with you. We got down there and I went into the hospital and I'm still not really there yet. I'm not in, my brain is not here. We sat down. I got called in to do like the insurance thing and the financial stuff. And I come back out and I'm like, yeah, they were asking me the questions about this. And my wife's like, yeah, okay. And that's when they called us in. And now I'm like, okay, here we go. I think the closest experience I've had to this moment was the night before I shipped out to boot camp in 2001. That was July 24th of 2001. And that night before, I just closed my eyes and got sleep. And I'm just like, I'm just going to move my body and we're just going to get into this. Because the only way I'm going to get there is just to do it and not overthink it. And that's really hard.
Exactly.
Because I do overthink everything. But yeah, they got me upstairs. I was expecting my family to be able to join me up there because when my wife had her surgery, I was able to be with her in that surgical prep zone, but she never came up. They had me change my clothes. The surgeon came in and, hey, how you doing? And she was again even more excited than she was before, and because I had hit 194.1 pounds. No, 191, 191.4.
Wow, good.
That day. And funny because they also had me, she's like, you know how tall you are? I said, yeah, 5'7". And she's like, get on the scale. old nurse said, get on the scale. I'm like, what? Is there something wrong? And I get on this digital scale and she just 5.69. So 5 foot 6.9 inches. And she's like, nope, not quite 5'7". Let's try that. And I'm like, round it up. I mean, but that does affect your BMI score depending on where how tall you are.
Right.
So I put in 5'6" before to see what it does. And it's like, oh no, that's a big bump. But no, I made my goal. My goal was 190, and I was still right there. And she says, have you ever had surgery before? I said, no, this is my first. She's like, oh, honey, you picked the big one. Start with it. Like, but we're going to take very good care of you. And she said, are you ready to go? And I'm like, sure. I was on autopilot at this point. Nothing I thought they were going to do, they did. I walked from across the room and down the hall into the surgical suite. And I walked into the surgery room, and it's like, there's so much stuff you see on TV when it comes to healthcare is just not accurate. It's not very realistic at all, unless you're watching The Pit. The Pit's amazing. But suites are always shown as these large rooms with people gowned up and dancing to music and just doing goofy things and having a great time. And that's exactly what I saw when I walked in. They were just everywhere, there was music playing, they were dancing, and it was just a very cheerful, very light-hearted atmosphere in the room. I had two gowns on. One was forward, one was backwards. They had me take out the top one, let me remove my pants, and I had my slippy socks on. And they had me get up on the table, and I'm like, oh my God, I am actually here. The whole time I'm in the room, like, I'm actually doing this. This is happening.
Right.
And they had me lay down, and they had me put my legs up in stirrups, and they're putting on all the various sensors and probes on me. And the lady comes over and says, I'm going to be putting in your IV now. Okay, just pinch a little, and it did more than pinch a little. And she got it in, she taped it up. I've never had an IV before, so that was another new one to me, and I still don't like needles. I've only had years of injecting myself with estrogen, and I still don't like needles. So,
Exactly. Yeah.
but she's like, we're gonna give you a little bit something to make you, just make you more comfortable. And I could feel the cool sensation of something flowing into the IV. And I was expecting someone to say, all right, we need you to do this, that, and the third, and then we're going to count down to 10.
Wow.
And she said, we're going to give you this. And I looked over this way, and the lady was just finishing up putting on the probes. And then I looked over this way. I blinked. It felt like a slow blink. And I looked over this way, and there's a clock on the wall. I'm not in the same room.
Yeah, it was lights out for you.
Going on? There was no turning. I was scared that that's actually made me most nervous. Was I've never been under before. I've never lost consciousness before. So that was like a big see. To give context, we got there at 5:00. They brought me up some room by 7:15, 7:20. They walked me into the surgical suite after 7:35 because I'm looking at clocks all the time, millions of time. I'm obsessed with that. But when I looked at the clock, when I'm look this way and I look at the clock, I'm like, oh, is that 4:25? But it was 7:35 just a moment ago.
You slept through the day.
I slept through the entire day, and my wife was downstairs. I didn't know how long it was going to be. We didn't even think to ask about that. So this is oh dear. But first thing I did when I came to was I was thinking about, well, what do I feel any different? What do I feel? Started doing a check. I felt nothing. I mean, it wasn't even drugs, still nothing. It's just nothing felt off. I could tell that there was something warm and packed in between my legs, but that was it. They would come in, they'd move me upstairs, and that's when the recovery portion started. They had gotten me up to walk. Now, I should say, I had a catheter in. They always put a catheter in. And for me, they gave me a wound vac to kind of keep the surgical area under negative pressure to pull fluids away.
Right.
It helps with healing, helps keep everything in place.
That wound vac is so important.
It's very important.
It makes a big difference in the healing process.
It does. I've heard so many stories from people who didn't get it, including right after I had my surgery. And besides, adorable. It sounds like it makes a little squeaking oink sound, like a piglet. Going, and I'm like, the next week I had this thing. It's
right. If they don't use the wound vac, and then all of the fluids and any of the bleeding stay in there the entire time with the packing.
That would encourage infection. That could encourage inflammation. Right. And this helped keep things, very clean, very neat. They tried to get me to walk the first day. Not long after I got into bed. So this is probably around the next morning.
Day 2?
6:00 in the morning, Friday morning. Yeah, they said we're going to try to walk to the door and back.
Right.
And I stood up, and they were kind of changing my sheets while I did it. She's kind of holding me, stabilizing. That's what they're supposed to do, is stabilize, make sure you're steady on your feet before we try and move you, right? So she's like, you okay? And I said, I'm all right. And I'm like, I'm a little bit dizzy. a little bit. And then the next thing I know, I'm looking this way back out the window and I'm halfway back in bed. I passed out. My blood
Oh,
pressure was dropping. My heart rate was very low. They ended up giving me oxygen for a while through an nasal cannula. They were monitoring my blood pressure and all that other fun stuff. So that's when I earned this lovely thing, fall risk. I put on other people for my clinical rotation, but I've never worn one before. Would not be the last, however. I got to walk again later that evening. The goal was to walk twice a day. And they did try to get me to that point. The hospital took care of me Friday, Saturday, and then Sunday morning they discharged me. It was mostly liquid food, a little bit of solid stuff. There were no food restrictions. I was not in pain. There was a standard course of pain meds, but I really wasn't hurting. I felt nauseous the first night. I actually ended up throwing up my first liquid meal, but after that, I was fine. Going home was different, or I was going back to the apartment where we're staying. You want to bring something that's loose.
Oh,
So
yes.
I've got my catheter. I've got my wound bag. I am shuffling. I'm not wearing shoes. I was wearing very, very loose sweatpants with drawstrings on them, so that the lines could come up and out of them. And they had helped me into the Uber, and we went home.
You're swelling down there after
Yeah,
the surgical procedure, and it's a lot of swelling.
and that's the name of the game that my surgeon made very, very clear. She said, listen, the number one thing, and she would tell me this on my next visit, which would be the following week, said controlling swelling is going to be everything. If you control swelling, you're going to heal faster. You're going to have less issues. And she's like, moving less is going to help keep the swelling down. So their instructions were be a couch potato. You are to be a couch potato for the first month. And I'm like, all right. So we did that. I only was getting out of bed with help. Go to the bathroom because obviously, I got a catheter, but that only helped with half the issue. But my first bowel movement would be on Monday morning the following week. So I went from Friday to Monday without a bowel movement.
Wow.
That was kind of scary because it was something that did cause another low blood pressure situation. So I almost passed out there too. So they're not joking when they say you need somebody who can help you when you're recovering. And fortunately, my wife and my family friend was able to help me like that. Diet was super important, keeping protein very high, fiber high. I was not watching calories anymore because for dieting, you want to watch calories. For healing, I don't care what those calories are. I just need to make sure I'm getting lots of protein because protein helps.
Right.
Yeah. When I had to go into the doctor's office, she told me, because I think it was a week later, we went in and they were pulling out catheter. They were pulling off the Lynn bar. Now, this is something I'd heard a lot about. In that was, I'd seen in the documentary, they show someone getting that removed and it looks painful. And you can imagine that it's going to be really uncomfortable and just feel very strange. And at the time, I hadn't seen anything down there. It had been covered with bandaging. I didn't want to really look anyway. I was like, I don't want to see anything yet. But I went in, they got me up on the table and they said, okay, we're taking off the wound vac. They pull off the wound vac, they take that away, they pull out the catheter, which looking back was the most uncomfortable part of the entire thing. It was just the catheter. And if you've ever had a urinary catheter, they are not comfortable. And I will say this, women have an advantage when it comes to catheters. It may be hard to find the urethra to get that thing in there from the nurse, but it's a lot less pain coming out because there's less urethra there to burn.
Right.
Guys have a lot more, and that thing burns, let me tell you.
Right.
But they pulled that out. It was a little bit uncomfortable. And then they said, okay, we're pulling out the packing. And I'm like, okay. I had been told to breathe. You want to relax. You want to, just, you're doing a breathing technique. You're just kind of trying to let go of everything. And they pulled it out. And It was definitely weird. It wasn't super comfortable. It was definitely a bit weird, but it wasn't super painful. I mean, there was one spot where a bit of the gauze had caught on the suture because there's sutures inside.
Mm-hmm.
And I was like, ooh, that was different. But it wasn't bad. There was, for me, there was very little bleeding. And that's when they do the first dilation.
Mm-hmm.
And dilation is the next really big thing. Dilation happens. That's going to be your life the next 2 years straight. Um,
Exactly.
and there are 4 dilators, except that they gave me. They're silicone, and they're in increasing sizes, and they're usually
Mm-hmm.
referred to by their color. So we've got purple, blue, green, and orange. They helped put in the purple one first. And I'll tell you, it was like, it was different. I wasn't sure I wanted her to do it because it's like, I want to control it because I want to control any pain that I encounter. But she did the first one. It wasn't that bad. You know, you put lubricant on it. And then I had to do it. I had to demonstrate that I could do it. And I took it and I put it in and I managed to get it all in. She explains, you know, how long far to put it in, you know, how long to leave it in. And she said, you're going to do this yourself when you get home. So you need to do it when you get home today. But from now on, you need to do it 3 times a day, 20 minutes on the largest dilator that you're comfortable with that you can get all the way in. And then I want you to do 5 minutes on the next size up as far in as it's comfortable.
Mm-hmm.
And you move up. And the purpose of the dilator is to keep things stretched out as the vaginal canal is healing. They don't want it to form scarring and start to stenose. The term is stenose, vaginal stenosis. Basically, when the vaginal canal shrinks and it doesn't want to stretch out again, you want it
Mm-hmm.
to stay open and pliable as much as possible until it heals. So for the first
Mm-hmm.
year, it's 3 times a day, every day. Second year, you can start to reduce a little bit. After that, you can, you know, a lot of people just kind of do when it's convenient. It's kind of like getting your ear pierced. You want to leave those studs in for 6 months at first because it's going to try to close itself. It's a wound.
Right.
Then, you know, even in the first year, if you leave the earrings out too long, the holes try to close. Well, now I've had my ears pierced since 2016, 2017. I can take my earrings out and leave them out for months and they will not close.
Right.
Same idea here. The body is healing, and once it's healed, it's not going to try to close, which is something that a lot of people don't understand about it. You hear a lot of misinformation about, oh, it's an open wound that's trying to close itself. No, it's not. And the entire procedure that I went through was first done in the 1930s,
Mm-hmm.
and it was developed to help cisgender women who have vaginal agenesis and who've had cancer and had to have things removed. This was literally designed for cisgender women and then adapted for trans women. So, you know, it's not a big deal. At first, it kind of hurt a little bit. I had blood come out once, and they tell you you're going to get a little bit of blood. It's going to be discharge. Not a big deal. You're going to get a little bit of that at first. And I can show you if you want to know what they look like. If anyone's curious, it's up to
Lynn?
you.
It's up to you. No, if you want to
Yeah.
show,
Yeah.
They're
we'll
they're
just tell people that got a little warning here that Krystal's
Right.
going to show these if you don't want to see them.
These are just the dilators. They're silicone.
Yeah, there's a,
yeah, it's a medical device, and women, um, other women do use them for various things. So these are not something that are exclusive to trans women, but these are 3 of them. The purple one is the smallest. I don't really use that one anymore. I don't really need to, but there are different sizes. They get larger with each one, and they are numbered. You can just barely see these are numbers 1 through 5,
Right.
and that helps determine how far in you're getting. And when I first went in, I was basically one finger length, this little finger through here. That's how much was
Mm-hmm.
in. And your goal is to maintain that because this is going to tell you if you're losing depth. A lot of people do lose depth, especially if you're not consistently, dilating. And I'm by week 5, I was on this one, which my wife
Right.
affectionately calls Mandingo.
Mandingo.
She said that Out that while I was in the middle of dilating one day, she came in and it's like I just gotten over the awkwardness of dilating while my wife's standing there. And she's looking at that, and I hadn't gotten to use that one yet. I actually had the green one, and she's like looking at the orange one. She's like, "Oh my god, even I couldn't that Mandingo." And I'm like, speaking accent, I could not help myself. You don't want to laugh right after surgery. It hurt, and the thing shot out across the back,
Mm-hmm.
and it was just one of those things like, "Oh my god, this is ridiculous." But it was just it's not a big deal. I was worried, like, because I got to figure out how to fit this into my life now with work and all that. How's that going to work? And I know, no, it's not a big deal. It's something I just do it. I do it quickly, and it's not that big a deal at this point.
Right.
But that's a big thing, and they say do not skip, do not skip. And everyone that's had vaginoplasty will remind you, do not neglect to dilate.
I met a girl at NYU who had surgery there like I did, and she just kind of stopped dilating after a couple of months. It collapsed.
Mm.
She had to go back and do the whole thing over again.
And
So,
it's not
for any
fun.
transgender people listening to this, if you're going for the surgery, you have to commit to dilating. Otherwise, you're wasting your time, your money, and your effort.
Yeah, it's a whole list of new things to learn.
Mm-hmm.
Obviously hygiene is something you got to relearn. It is serious. It's something that, yeah, I mean, you're going to be going to gynecologists for issues,
Oh,
just like
yeah.
this do, and surgeons that kind of help out with that part. But it's just, there's a lot of learning curve to it.
Mm-hmm.
I've never done that thing that a lot of trans girls do or post-op where I go to the bathroom and reach down and it's not there. I've never done that. I can say that much.
Right.
But one of
No,
the
no
things that,
phantoms.
right, I've never had phantom pain.
Right.
I used to be able to close my eyes, mentally remove things and not feel it anymore and kind of feel normal. It felt normal to not feel that thing that was down there.
Mm-hmm.
That's what I was thinking of. Is like, what's it going to be when it's gone? Even though I feel like it shouldn't have been there to begin with, it's been there for so long and I've not been able to function without thinking this thing is here and it's annoying.
Mm-hmm.
How am I going to feel?
And how do you feel?
It doesn't, I just feel normal. I don't, there's no other
Exactly.
word for it. It just feels normal. I just feel like me. And that's something that even now at, I think, what am I, 10 weeks, 11 weeks,
Mm-hmm.
almost, well, yeah, 11 weeks, it's almost 12 weeks next week. So realizing, how much of a problem this really was for me. I
Right.
didn't, and as I mentioned before, I didn't know how badly I needed the surgery. I really thought I could go without it. And the more I dealt with issues, the more I realized, well,
Mm-hmm.
maybe I do need to do something like this. Well,
Mm-hmm.
now that it's gone and that sensory overload is finally gone,
Mm-hmm.
it's like my mind is quiet, my body is calm. It's like, I'm like, I don't know how to fully, it's the only way I can describe it is I feel peace.
Yes.
And it's just, I am so jealous over cis people who get to feel like this every single day.
Right. That's the
And that,
congruence that cisgender people already have and just don't even think about it.
yeah, and that kind of leads into the last thing, and that's, you know, this is kind of like the last big step for my transition. This is the last
Mm-hmm.
big thing that I needed. And it's like now there's all this literature out there on getting ready for surgery and stuff on the technicality of the surgery itself. But there's very little on what it's like on the other side. There's very little on what it's like to
Right.
be a trans person who's completed your transition. Most trans elders disappear into the abyss and they just live their lives. They don't want to discuss being trans anymore. They just want to live their lives and nobody
Mm-hmm.
can blame them. It's something that we've been denied our entire lives.
Right.
And once we've transitioned as far as we need to, it's like, I don't have to think about all this anymore. And while that's great for them, it's a tragedy for those of us who aren't there yet who would benefit from learning from these things. And it's just like, I didn't have anybody to tell me, oh yeah, by the way, you think you're gonna be feeling better and better and better the longer you go, even after the surgery is over. So it's
Mm-hmm.
like I can now walk around normally, I can go up and down stairs, I can sit mostly comfortably. I still kind of need a donut once in a while. I do feel a little bit of pressure up the suture line when I check it with a mirror, which by the way, this is a required uh, tool for post-op.
Yep.
They
That
want you to be able to see, they want you to look, they want you to learn where things are, and it really helps with dilation initially. Um,
absolutely.
but you don't realize that it's going to continue to evolve and change. And it's like, I feel more like myself now than I did when I woke up. Obviously, I was kind of drugged up at that point, but I was thinking about it the other day, and the question that always comes up, and people say, you know, is there anything that you're grateful for being trans? What's your favorite part of being trans? What's a good thing? What's a positive thing about being trans? And I always hated that question because I'm like, I wouldn't wish this on my worst enemy. It was just a question I don't think I could answer. It's just that doesn't I can't honestly say that at the time I found anything that was a positive. This is a nightmare. You know, I already feel othered from being left-handed and neurodivergent and all this other stuff. Why would being trans feel, you know, why would there be a positive thing about being trans? It's just another thing some people categorize me out of society with. And now that I'm here and I'm feeling what I feel like, I realize, oh, there is something. There is something I feel grateful for. And I'm like, I appreciate my body. I appreciate my womanhood. I appreciate the ability to feel comfortable in my body and appreciate my ability to express it in a
Mm-hmm.
way that had I been born cisgender, I never would have been able to experience. I mean, women, especially women, I mean, guys, not quite as much, but especially with women, womanhood is so loaded with unpleasant aspects because our society just treats women as second class citizens. And it's like, it's a horrible thing and it shouldn't be. And I will fight that tooth and nail for the rest of my life from the
Right.
inside. But the reality is, this is the most beautiful and amazing and just incredible experience of my entire life. I could not begin to explain just how good I feel to finally be me and how much I appreciate it. And that's, you know, something I don't think I could have ever appreciated to this degree if I had been born cisgender. I would not have had that perspective.
Yeah, you wouldn't know anything was different.
Yeah, it would have been my life. And now it's like
Yeah.
I know what I didn't have and
Mm-hmm.
I appreciate it so much. And
Mm-hmm.
I get to be the real me, and the real me now is a completely different person that I'm proud to be and I'm glad to be, and I appreciate this. And it's been an opportunity, and I can finally say, yeah, there's something that I'm proud of, and I'm glad that I'm trans, you know, to have
And
been
you
able to
will
experience.
continue to evolve. I can tell you after 11 years, it doesn't stop. It just keeps growing and getting better.
Yeah,
Well, you've had to work so hard for it, Krystal, and
Yes.
that's where the gratitude that I'm hearing you say comes from.
Yes.
You know, it wasn't something you were given and that you took for granted. It's something that you've gone after, that you knew was you, and that you've done what you needed to do, and that the gratitude just comes flowing out of you because of that.
Mm-hmm.
I've had to
Beautiful.
fight tooth and nail for every single aspect of this, and it has been more worth it. It's been a harder fight than anything I've ever done. It's been scarier than anything I've ever done, but it's been more rewarding than almost everything I've ever done outside of fighting for my children, of course. But outside of that, I can't think of anything that's made a bigger difference in my life than choosing to attack this head on and actually deal with it and invest in myself. And everyone around me is benefiting because they now have cheerful, happy, well-adjusted version of me that's far more engaging and far more, emotionally available than I was before. So
And why
That's what it,
wouldn't people want that for you and for other people who are
Mhm.
transgender? That's what I don't understand. Why are people attacking people who are transgender? And to see the change in you and the happiness. We talked to you a few months ago, and you were delightful then, and now just to see the joy and to hear the things you're saying, Krystal, it's
Mhm.
so amazing. Especially as a cisgender woman who just took for granted that I'm a woman and I've got woman parts and all that, and thinking about some of the things that you've learned about that we women have had to deal with all our lives. When you talk about hygiene and things like that, okay, it's a little different for women than for men. And we've never had to think about that.
Right.
And so I don't think cisgender women necessarily, I guess speaking for myself, have ever really thought about what it's like. And then we hear these people say, well, you're not a real woman. Well, that's nonsense. I mean, absolute nonsense. You have worked hard to be the real woman that you are.
Right.
And that's so amazing. Thank you for sharing all that.
Yeah.
thank you for giving me the opportunity to share it.
Wow.
Anything further that you want to say before we close this episode out?
I think the thing that makes trans people such a powerful and culturally challenging part of humanity is that we do offer that perspective. Trans men and trans women have a view on manhood and womanhood that other people don't have. And there's an appreciation for that a lot of people do take for granted because you just have it and it's not something you ever question because it's always there. Someone who's got plenty of food and water doesn't think about how great it is to have that, but someone who has none is they're going to value every last drop and every crumb of food that they can get their hands on.
Mhm.
And I think that's both a beautiful thing, and I think for some people in society, it's a threatening thing because I value something that a lot of women resent. Why would I give up this convenience? Not gonna lie, it's definitely more convenient to be able to stand to go to the bathroom, but I'll tell you what, being able to feel good about my body and feel like I'm
Uh-huh.
full is far more important and validating to me than a novelty convenience.
Mhm.
And it's like we call a lot of these things into question. What does it really mean? What does it really mean to be, a human, to be a woman, to be a man? Is there really a difference? And to be honest, human beings are amazing, and that should just be it. The human race is amazing if you let it
Mhm.
be amazing and stop trying to categorize everybody as, oh, well, men are better, manhood's better, woman's worse. Like,
Right.
no, these are two equal halves of a very important whole. And trans people kind of highlight that by
Mhm.
existing.
Exactly.
Trans women value womanhood and are willing to give up that masculinity, that male privilege.
It was
And
never a privilege.
exactly, it's not a privilege. I didn't ask for it. I didn't want it. It certainly didn't
Mm-mm.
serve me in any way that was meaningful. Besides, I was always small and treated like garbage anyway. So I wasn't getting a lot of benefit out of it. I was always being called a girl anyway. So it's like, oh, no, wrong.
You always were a girl.
Yeah.
Exactly. Your brain developed as female,
Yeah.
and now you just corrected your birth defect.
I did. That was
Uh-huh.
quite
And
painful.
there's joy on the other side.
I didn't know life was supposed to feel this way, and I wish I knew a long time ago.
Thank you, Krystal. We're so happy for you. And I'm so thrilled that you agreed to do this interview and talk about your surgical experiences. Lynn, do you have anything else to add today?
Well, thanks, Wendy. And Krystal, thank you so much. This was so educational. There's so much that I didn't know. And I think you weren't just educating cisgender people, you were educating some transgender people too. And I really appreciate the way you approached it, your thoughtfulness, your introspection. You weren't just giving us the MD version of this, which, by the way, you do, like you mentioned, you do have medical experience there. But it was the inner part, especially at the end, that really touched me, how you talked about that, how it felt like you were complete. And the things that you had to go through to get there, the lifestyle changes. Like Wendy has said, it wasn't just you show up one day and said, I think I'm going to do this. So thank you for that. And I'd like to say to our audience, if you haven't seen Krystal's 2 episodes that we have done prior to this, please go find those. We'll put the links to those in the show notes too, so that you can see Krystal before she had surgery and after she had surgery, and just see the glow in her. It's amazing. So Krystal, thank you so much. This is just a very different interview for us, and I can't imagine anyone doing it better than you did, doing it with more heart than you did. And thank you so much.
And to anyone out there watching, listening, thank you for being here, for leaning in and helping us build informed allies who can multiply compassion in a real world. On behalf of Lynn Murphy and me, thank you. And thank you to our audience for spending time with us on Demystifying the Transgender Journey. And as this episode shows, you can't just snap your fingers and send your kid to school and they come home a girl, surgically created. That will never happen. And to think that anyone can just have this immediately and go through this process without any of the medical checks that the community does, that the therapists do, that's also wrong. There's a lot of controls over who has surgery, how and when. So if you found this episode meaningful, informative, heartwarming, or any of those, please like, share, and subscribe. Helping us share this out expands our audience and gets the message out cleaner. So thank you for being here today, and stay curious and stay kind, as Lynn always says, and she's absolutely right. That's what this is all about. Thank you.
Thank you for joining us today on this episode of Demystifying the Transgender Journey. Remember to subscribe so you don't miss a single episode of our fascinating interviews. You can also find more information on our website, thetransgenderjourney.com. So until next time, stay curious and stay kind.